what tools could we get to these people that they could actually go to their drugstore, that they don't have to go to their doctors. The doctors' offices were closed. They were seeing people on Zoom. This is not, again, this is an odd situation. So what could we do where people could get something in their hands? And so we were reading the literature, and vitamin D just jumped out, right? It jumped out. There is a plethora of literature on it. And so that's why we really got into it. And then we decided, well, I wonder how the animals are doing, given that, when we take them out, we put coats on them, or we don't take them out. And let's face it, in where we live in Canada, we're in the Northern Hemisphere. And dogs are getting some of these disorders like humans, like cancer. And then we see, oh my goodness, there's a whole literature on vitamin D and cancer. Let's start looking at dogs. And then we started talking to holistic veterinarians who were using vitamin D in cancer therapy in dogs already at fairly high doses, right? 100,000 international units 3 times a week as cancer treatments. And so we were starting to wake up in one heck of a hurry. And as you do, then you start to get more and more questions, and you just keep going. We're just kind of following this line of questioning. We're now trying to figure out how the genetics of immunity connect with the genetics of vitamin D, and how this works across different species. And there are tests for humans, various tests of different qualities, but not so many tests, and certainly not sort of tests that a veterinarian or a farmer could use right at the side of the animal, right there with the individual. So again, that just started us on down this whole road of rapid testing, where a physician or a healthcare professional or veterinarian right in their hand could have a tool to measure. And then, we started talking about thinking about and looking at the quality of vitamin D, and figuring out, oh, not all vitamin D is created equal, as it turns out, either, right? And if you're supplementing a horse, you're going to supplement a horse different than you're going to supplement a human or your dog. So that's how it all began. And right now it's just going crazy. And then we decided, well, my goodness, how are we going to further educate the public?